Welcome, fitness enthusiasts and ultimate frisbee aficionados, to the Tobu Fitness Podcast, your guide to elevating your game and mastering the art of ultimate frisbee through the lens of strength and conditioning. Whether you're a seasoned player or just stepping onto the field for the first time, this podcast is your one-stop destination for unlocking your true potential. This is the Tobu Fitness Podcast with your host, certified strength and conditioning coach, Justin Shelby.
Real quick, before we get into the episode, got to make a quick ask. If you could share this episode with your friends, family, on your social media, whatever it is, it helps me out a ton. I think there's a lot of great information in this episode, and if you can get it out to help more ultimate players, I think that's always going to be great. So if you could share it, that would help me out a lot. Let's get into the episode.
What's going on, everybody? Welcome back to the Tobu Fitness Podcast. This is episode 14. We've got a great guest on today. This is Dr. Ryan Andersen. Ryan, how you doing?
I'm good, Justin. How are you doing?
Doing well. Thank you for being on the show.
Of course. I'm really happy to be here. Happy to chop it up, talk ultimate, and talk a little medical.
Yeah. You want to start off by telling people a little bit about your background?
Yeah. I guess I can kind of start way back in the college days. Went to the University of Pittsburgh, had never really touched a disc other than a track practice. We would toss around a little bit and kind of just have fun, play 30 on 30 ultimate. That didn't really look anything like ultimate. And then one of my first days of class just happened to be walking back and saw a bunch of people running around and frisbees flying and thought it looked kind of interesting. So I popped over to the field, and first person I talked to was Trent Dillon, which was pretty cool. And then from there, the rest is history. I played 4 years for Pit B on the developmental side. Got to see a lot of really successful players go from Pit B up to Pit A and kind of work on their development with them. Kind of took over from Jonah Wish on the strength and conditioning side of things in I think it was my junior year. I took over from him because he had graduated. And then from there, went through PT school, kind of took a little bit of a brief absence from ultimate just to kind of focus on that. And then when I moved back to New York, where I'm from, got my first PT job with Spear Physical Therapy, which is an outpatient orthopedic group. And then basically 4 or 5 days later, landed the Empire gig. So I do all of the PT for the New York Empire of the UFA. And I guess that's kind of my jumping point. And now I've kind of branched out a little bit from there, doing a little bit of online consulting and working with players and really just trying to grow the sport and try to grow the players that, participate in it.
What a cool gig too. 4 or 5 days in, suddenly you land I assume like a dream gig, in that moment, right?
Yeah, I mean, it's such a dream gig. I don't really do a lot of future planning, those big 5-10 year plans, just because I feel it's so arbitrary, or it's so it's difficult to look that far ahead when you're focused so much on the moment. But my 5-year goal coming out of PT school was hey, let's find a team to work for, get my sports clinical specialist certification, and then from there kind of branch out and start working with the team. And to be fair, I got the Empire gig by no merit of my own whatsoever. I just happened to be in the right place at the right time. My boss at the time was really friendly with our team doctor at the time, Dr. Megan Bishop, and she's been awesome. She basically hooked me up with Matt Stevens, and within 1 day, I had the gig, having never met Matt, any of the Stevens family, or any of the Empire players. And then the rest is history from there. They've been really good to me, and I hope that I've been pretty good to them. And it's been such a wild ride, even to just kind of look back on it. And over the last 2.5 years or so, still can't believe that this is what I get to do every spring, summer, and fall.
Cool. What have been the biggest things that you've learned from working specifically with the Empire, as I guess compared to just the everyday club player or college player?
I think how particular people can be about their bodies and what goes in, and how they actually, go about warming up, cooling down, going through the motions of a game. I think I underestimated how specific things need to be. And being a PT, obviously my job is as specific as possible to what you want to rehab back to. But These guys go to, great lengths to be as specific for what their body needs and what they need to, perform on the field. It's something unlike I've ever seen before. And coming from like a pretty high level program at Pitt, I feel like I got a good amount of exposure to that, but these guys have just taken it to the next level. And it's really cool to see and be a part of. That's
super cool. Yeah, I remember watching at championship weekend. I'm from Austin, so was watching the Soul unfortunately get it wasn't their best game against Empire.
They had a really good start. They punched us in the mouth big time. So as somebody on the sideline, I was kind of looking around like, okay, like when are we going to turn it on here? They had a really, really impressive start there.
Yeah. But I remember watching, and the big thing that stood out to me was, and I remember vividly like a image of like Ben Yacht taking like the can of oxygen, I assume. I remember seeing a lot of stuff on social media after championship weekend talking about that. Can you talk a little bit about what that is?
Yeah. So this was kind of in preparation for our doubleheader weekend going to Colorado and Salt Lake. I had been working with a local university and actually doing a little bit of research with them, kind of based on, athletic performance and kind of how it relates to like rehab, and almost doing like a little bit of prehab for when you're going up to altitude. Really purposely because I knew we were going to go to altitude and we weren't going to really have a lot of exposure beforehand. So I was trying to work out getting these guys in to do some altitude training with a altitude simulation unit. And just the way that like really the logistics worked out, where it was a really long trip for all the players to get to, and they had to do it multiple times a week, like following the protocol, so we could get a little bit of research data out of it, but also, see a clear benefit. It just didn't really work out. And we were looking for alternative options, both myself and Alexis Sarabia, who is my colleague working with the Empire. And actually, Coach Nunez is the one who suggested the oxygen tanks. And I had never really like heard about them. I assumed that like, when you hear oxygen tank, you think like the big tank with the nasal cannula, the little strips that kind of come over your nose, or you have that big mask. And that's not something I can ship out to somewhere or bring on a plane with me. So I was kind of at a loss. But when he showed me these little cans, I bought them. I tried them out, and you can get them at like your local Lowe's or get them on Amazon. And I tried them out, while I was trying out and still playing and running around, and definitely saw some benefit from it. Just kind of felt like I could catch my breath a little bit faster, especially, when I was putting in like really hard efforts, think like 85 to 100% max effort. And I felt that I was able to recover quicker. And we tried it out at practice a couple of times. Players seemed to not have any negative effects there. So I thought, hey, let's try it out when we're in Colorado. Worst case scenario, these guys are just breathing oxygen. That's it. And I think a lot of the guys saw a lot of clear benefits from the altitude. Like we had no cases of altitude sickness or any kind of altitude related issues during either of those games. And then I kind of spun using those oxygen tanks into a anti-cramp program for some of the players who got what I'll call ischemic cramps, or essentially just oxygen deprivation cramps, mostly centered around the calf and the hamstring. And since then, I use them in my regular practice whenever I'm on field. But yeah, all of that was prompted by Coach Nunez, and I think the Bryce Merrill comments at halftime when he said, "Yeah, was sucking down cans of oxygen, and you didn't want to let him get out of the game that easy." Really sparked an interest in those oxygen cans, and I don't know, maybe I've made Boost Oxygen a little bit of extra money.
You gotta try to get sponsored after that.
Yeah, seriously, get some free cans or something. But yeah, that's where it all started, and I think the guys have kind of run with it from there.
Can you talk a little bit more about the anti-cramping protocol there?
Yeah, so in studying for my sports clinical specialist exam, a lot of what we focused on the medical side of things were things like heat exhaustion and cramping and sickle cell anemia, and how those things kind of are all somewhat interrelated, but kind of distinct in how they actually present. And in investigating some of those cramping lectures and some of the information there in the research, was kind of able to dissect that sometimes cramps are just from overuse. Like, hey, you're just beating this muscle up over the course of a single game, multiple games, multiple days worth of games. Sometimes it's just a nutrient deficiency where you're just not getting enough electrolytes, specifically like sodium and potassium. That's where like, the pickle juice and the bananas kind of come in. And that last section is ischemic cramps, where the muscle is working so hard that you're almost actively like restricting how much blood or oxygenated blood is getting to the area, or you're working at such a high rate that the oxygen delivery that you're getting to the muscle doesn't match the demand. So the thought behind the oxygen tanks is to essentially bring up the amount of available oxygen that's present, within the body, make it, delivered as quickly as possible. And then from there, adding in your conventional kind of anti-cramp strategies, like a little bit of stretching for the muscles that typically cramp or feel like they're kind of going in that cramp direction. Consistent electrolytes, not chugging down water, as soon as he comes to the sideline, but consistently just, sipping on some kind of electrolyte drink. And I found that every player is a little bit different in what they need. Where, we have one player who consistently in the fourth quarter gets cramps in his calves, like almost like clockwork. So as we're kind of getting through halftime and getting into the second half, I tell him, hey, like, let's start that anti-cramp program because we know that's going to happen. We know we want to get a little bit ahead of this. And a lot of that stuff also comes from like pregame and, the couple of days before, but especially in game, kind of have to make those adjustments. And everybody's going to be different. So some players, do really well with the stretching. Some players do really well with the oxygen tank. Some just need electrolytes. And I think the art form in all of this is trying to figure out what works best for everybody. And honestly, sometimes it's just a little bit of trial and error.
Yeah, 100%. I guess almost like summarize afterwards that like definitely the trial and error. So I'm glad that you brought that up, because my mind already goes to like the average listener would probably listen to this and go, oh my God, I cramp. I need to go buy a bunch of oxygen tanks. And it's like, well, first thing is like, make sure the easy stuff is like taken care of. Like make sure you're hydrating first, make sure you're stretching and warming up first. And then it's like, all right, then if all else fails, like, then let's look at some like deeper options. Right.
Yeah, this program is kind of like after we've exhausted all the options and kind of inspected how these players do in just like their regular training, in regular practices, and then, kind of trialing it out in some of the regular season games too. And this is, realistically, it's taken me about a year and a half to like really perfect this program, or somewhat perfect this program for an individual player. So it's been quite interesting kind of working back through some of the data that I've collected myself as to like when they cramp and what's the temperature outside and the humidity and all of those other factors. And sometimes it just comes down to like, hey, they sat in a car for, 2.5, 3 hours coming here, and we got to stretch the calves out and maybe give them a little bit of oxygen just to kind of, keep their system in check and make sure they're not, oxygen deficient, and all of that oxygen can get delivered to the muscle.
Right. Yeah, that's super, super cool. And I'm sure each player has a very individualized kind of protocol or ideas. Yeah.
Oh, yeah, absolutely. And that goes for pretty much everything that we do on the field. We kind of have like a general warm up, but then each player, depending on, what they like, what makes them, feel like they're kind of like, springy and like ready to go for a game, or what they just kind of have always done. It really just differs player to player. Sometimes people really need me, and, they need me for 15, 20 minutes before a game. Some people are like, yeah, like, I'll see you later. Like, I'm good. I'm all good. And it really just depends person to person.
Yeah, that's super, super cool. I know, like, I know for pretty much every professional sport, like this is the standard of having like that team kind of behind the team. But then knowing, how a lot of the UFA teams are, just kind of the nature of professional ultimate, right? Like it's still a very growing thing. Like it's a growing league. A lot of teams don't have those options. So it's really cool to hear about a team that's like really investing into their support staff.
I think the Empire does it the best, at least as far as I've seen. There's great game day experiences, and like there's teams that do really, really well. And I'm probably a little bit biased here, but I think, it starts from the top down, and, Ellie Ouellette is like our director of operations, and she's probably going to hate that I even said her name on this, but she crushes it, and she puts all of us in opportunities to succeed.
It's super cool. I know we can't get too specific just because of like laws on individual injuries, but can you talk a little bit about what some of the common things you see are over the course of a season?
Yeah. I think the primary thing is like what I'll kind of loop in as like stress injuries, whether it's a bone stress injury, which are like not the most common, some kind of tendon stress injuries, whether it's like a tendonitis or a tendinosis, tendonitis being that more like acute and kind of like short-term aggravation of a tendon versus tendinosis being a little bit more of that like long-term kind of lingering tendon aggravation. And then soft tissue strains as well, any kind of soft tissue injury from more so overuse than like an acute injury. Thankfully, we've had, pretty infrequent acute injuries. But a lot of what I've had to kind of work through with players is managing load throughout a week or throughout a given season. And that's usually where those stress injuries kind of come in, where your preparedness, like what your body is kind of used to versus the demand that you're actually putting on your body, just kind of differ, and really trying to find a way to balance out those two stressors, or stressor and what your body can handle, is really, I think, my most important role.
Can you talk a little bit more about, I guess, like specifically what that might look like over the course of a week, let's say?
Yeah, so I'll kind of run you through like a mock example. With the turf that we had, or I guess was put down on our stadium field at home, it's a little bit different than the turf that we had played on the previous year, where your cleat can actually kind of sink into it a little bit more. It has a little bit more softness to it, and maybe not that like hard concrete layer that a lot of us as ultimate players are used to playing on, either indoors or outdoors. And with that, we found more foot and ankle tendon kind of stress injuries. So I was really trying to manage like, okay, what kind of footwear are you using during practice or your field workouts, your tempos, throwing, everything like that, and what are you doing before and after to really prepare your body and also prepare yourself for the next workout session or whatever you're going to do. So a lot of it comes down to analyzing the mechanics of how a player is actually moving around on the field. Are they a little bit more of that, foot and ankle dominant person? Or are they a little bit more of a hip dominant person? And then from there, actually looking at like the individual's, strength and range of motion of like their foot and ankle. A lot of it actually ends up revolving around like some kind of hip weakness, where ultimate players are really good at compensating and making sure that they can keep going through a game or a tournament. But kind of ignoring maybe the underlying reason why those stress injuries kind of come in. Specifically regarding the hip, a lot of ultimate players have really tight and weak hips, and that manifests in issues all throughout the body. But what I saw was specifically the foot and ankle, where when they're actually loading into that turf and kind of compressing into the turf, their hips are not strong enough, or their hip musculature is not strong enough to actually stabilize them. So they start to create, these kind of like weird and aberrant or kind of out of normal movement patterns at the foot and ankle that lead to those stress injuries.
That's super interesting. Did you find that, was there kind of like an underlying general cause of that? Like, is it more the nature of the sport, or is it like a lack of training?
I think it was a combination of different things, and like certain individuals, depending on like what they're doing in a given week, would kind of have different presentations with those stress injuries. Some players who were playing like almost exclusively on turf tended to have a really easily aggravated stress injury, where as soon as they put those hard plate cleats on a turf, any kind of turf, they would kind of re-aggravate things pretty quickly. And I think it really comes down to maybe the nature of the surface that you're playing on, the nature of the cleats or whatever footwear you have on, and then what you do, to prepare for games or practices or tournaments, whatever it is. And I think I do a pretty good job on the preparing side of things. I don't think I'm an expert in all the kinds of, synthetic turf, and like, how to go about actually, designing or having footwear for each specific turf. But I think it really comes down to, how do you prepare your body? How do you essentially simulate the load that you're going to undergo during a given game, or even just during a given season? So I kind of tend to not tell players like, hey, don't buy these cleats, or hey, buy these cleats because they, have a wide, toe box, or they're a little bit softer in the midsole, or they don't have that hard plate. Just because I think each player is, kind of entitled to choose the cleats and the footwear that they like. And I know that I wouldn't like somebody telling me to choose a specific pair of cleats. So I kind of tend to shift my focus more on like okay, we're in this situation now. We're not really changing the cleats necessarily. We're definitely not changing the turf. So how do we prepare you as best as possible to undergo the stress that you're about to endure?
Yeah. Now, with that said, and I want to talk a lot more about the prepared part there, but I guess real quick, with that said, about like the cleats,
Mm-hmm.
I know you said you're not prescriptive with cleats, but are there a pair of cleats for turf that you kind of generally recommend for people?
I personally, and like maybe I'm a little bit off, off the norm here. I really like playing in lacrosse cleats on turf. And this is just like a personal thing. I don't think this is like now it's like scripture kind of situation. I like lacrosse cleats. They tend to maybe be a little bit heavier, which players don't always love, but they have a slightly thicker teeth, not only like in the depth, like in terms of the size, but also the width of them. And I think you get a better grip on some of those softer turfs because, in the design of those lacrosse cleats, these lacrosse players are always playing on turf, or 95% of the time probably playing on turf. So those cleats are specifically designed to not only dissipate force through the cleat and through the foot, but also give you the right grip. So I think it also really depends on the kind of turf that you have. That softer turf, I think, works really well with lacrosse cleats. That thinner turf that almost feels kind of like carpet and, maybe has like a firmer surface under, I would maybe play in turfs or in some like low profile soccer cleats. But really, ultimately, like the choice I kind of leave up to whoever is, the player in front of me. If they like playing in their turfs and they play in their turfs all the time, that's awesome. And I'm happy to help them, work through injuries there. If they like playing in like really high profile and kind of restrictive cleats that give them a little bit more grip, that's okay too. And we kind of just work with that. So as a personal choice, I like to play in the Nike Huarache lacrosse cleats. But I can't imagine that many people share my same sentiment.
I definitely have heard that lacrosse cleats are super popular. Like I know the New Balance ones that I see a lot of people wearing, I think are lacrosse cleats.
Yep, I love those.
Yeah. So I imagine you're probably not too polarized, I guess, with that opinion there.
Yeah, and I think ultimately, like, wear a cleat that is going to work for you. Like if you buy something and it just doesn't feel right, you're getting a lot of blisters, or it doesn't fit your foot well, that's a sign that you probably want to change up cleats and find something that's a little bit more suited to your foot style and your playing style too.
So shifting gears back to what you were saying earlier about preparedness and how that affects stress injuries. I have an understanding of what that means, but I know a lot of people, when they hear preparedness, their minds kind of instantly go to the warm up and just preparing before what they're going to play. And I know, when we talk about preparedness in the field, it's a lot deeper than just the warm up. Would you mind talking a little bit more about kind of what preparedness overall means?
Yeah, absolutely. I mean, I think the warm up is definitely a major component to it. But I think understanding first the context in which you're operating really is kind of the key point. It's really where it's the foundation of how you actually cater your programming and how you're approaching each given week with a game at the end of the week. It kind of sets the tone for what you need. So looking at the UFA specifically, we know we probably have one game a week realistically, whether that's a Friday or Saturday. Sometimes we have those double headers, and those are a little bit trickier to prepare for. But looking at your week and saying, hey, we know delayed onset muscle soreness is somewhere in that 48 to 72 hour range post-exercise. Can we minimize that delayed onset muscle soreness? Not completely eliminate it, but minimize it to the point where it's not affecting peak performance on your given game day. So I think that kind of sets the tone for, okay, what workouts am I going to do during the week? Certain players really love to run tempos the day before a game. And I think that's great. I mean, as a former track runner, like I understood, doing a shakeout run the day before a race or even the morning of a race always made my legs feel a lot better. And then in the couple of days, even before that, early in the week, maybe getting your primary lift day done on a Monday or Tuesday if you're going to have a Saturday game. And that can be kind of like your big lift for the week. That way you not only have, time to let that delayed onset muscle soreness kind of, work through its process, But also in, the dire event that we have some kind of injury related to lifting, we have a couple extra days to actually like work through that and, work with your rehab professional, whether it's me or somebody else, to get you as close to 100% for that game as possible. And, it again, like it matters, what you do on your normal weeks, like kind of your non-game weeks, and kind of catering your program to suit, adding a game in and adding that, this extreme stressor and extreme load to the body. If you're able to, work through a pretty similar program to what you're doing in any given week prior, and just maybe tweak a couple of things, maybe decrease the intensity of some of those later in the week lifts. I think that's really important. Now, the other thing that I think kind of gets brushed under the rug, because we do a lot, in terms of like lifting and, field workouts and track workouts and everything, is like, okay, how are you also doing maintenance? So for me, maintenance kind of looks like, hey, are we doing our mobility work? Hey, are we doing, some kind of end range loading, whether that's, more dynamic stretching, static stretching, or whatever you want to do specifically. Or have you gotten that done, throughout the week, either before or after your lifts, before or after a field workout or a track workout? And are you doing, like, what are you doing specifically in the pregame from that mobility program that really translates into peak performance during the game? So what I like to do with each individual player is kind of walk through a week with them. We kind of call it like a mid-season week. Say, hey, okay, what does your workout look like? Or what do your workouts look like for this week? And players say, hey, I like to do this on Mondays. I do this on Tuesdays, this Wednesdays. I'll take a day off on Thursday, maybe do a little bit of a run on a Friday, and then go right into the game. I say, okay, that's great. Like we have a good, foundational plan in place. Now, what are the things that we've been having issues with over the last couple of weeks, or you just had, issues with historically? Whether that's like, hey, I have this nagging right shoulder thing that every time I throw flick hucks, like it just really bothers me. Or, hey, I have this back injury that if I do a really hard field workout on a firm field, it just kind of messes with me. Making sure that we hit on those little things and try to either remove, those extraneous factors from the situation, or tweak them a little bit and add in some mobility work or some end range loading under, relatively low stress. I think that's where people kind of miss the mark a little bit. Like, have we made sure that things can move effectively before we actually go and load them? And I think that's where your PTs and your more rehab professionals really come into play.
Absolutely. I think a great analogy I've heard to kind of describe it is like, you can't just keep trying to upgrade the engine of your car. You can't always just try to go faster. You've got to make sure you're also upgrading everything else, right? If you don't upgrade your brakes, if your car is misaligned, and then you just put a faster engine in, like, something bad is bound to happen. It's just how it is. So yeah, could you talk a little bit more about what that mobility work or like that end range loading might kind of look like, and in the importance of that?
Yeah. So coming from the University of Pittsburgh, a lot of what they teach us kind of like, it almost bridges the gap between like what maybe you would see a chiropractor do. And I'm sure people like on TikTok and everything have seen like thousands of chiropractor videos, but almost blends what a chiropractor would do and what a PT would do. So I kind of have almost like the skill set of both. So specifically for like mobilizations, making sure that, I guess as it caters to ultimate players specifically, making sure that, you're able to load into dorsiflexion in a closed chain sense without, an extreme amount of, those aberrant movements, whether, your knee is kind of cutting all the way in as you load your knee over your foot, or it's cutting all the way out, or you kind of feel this like compression feeling in the front of your ankle. Those are signs that, hey, maybe you don't really have true dorsiflexion. That's where I'm going to intervene with a mobilization that I can do, and also show people self-mobilizations. I think those are really the key, because, you don't always have your rehab professional with you at all times. So being able to educate players and athletes on ways that they can kind of do similar interventions for themselves, I think is really important. The ones that I use most commonly are for the ankle, like the talocrural joint, which is like kind of the main crux point of your ankle, where your ankle actually truly moves. And then for the hip as well, with usually a little bit of lateral distraction, essentially taking the ball in the socket and kind of just creating a little bit of separation between them. That way we can allow for a little bit more fluid to enter the joint. This is good fluid, not bad fluid. This is called your synovial fluid, and allow for the joint capsule that kind of surrounds that entire joint to be stretched out as a whole. And then where you find specific restrictions and motions, using mobilizations to target that joint capsule again, but now in a specific area.
And for those that are listening that maybe relate to that and they're like, oh, my ankle doesn't bend that well, or maybe they have some pain in their ankle, or there's some easy mobilizations that they can do at home with no equipment or maybe a band or something?
Yeah, that's usually what I end up using. And I think a lot of gyms and a lot of players specifically have those like pull-up assist bands, or what I call power bands. I'm sure that a lot of the listeners are probably familiar with them. And what I do is I kind of just anchor it to a stable, anchoring point, whether that's like a cable column in a gym, or, even the table that I use, like my treatment table, and I have somebody kind of sit on top of it, or even I'll just hold the band for the players sometimes, and they basically put it around the crease of their ankle, where they're on the front of the ankle. The band's going to kind of pull straight behind them, and you're just going to load your knee very gently over your foot, trying to make sure that the knee kind of goes over the center of the foot, heel doesn't come up, and you're not like collapsing your arch in any significant way. That's usually the one that I go for most frequently, just because I feel like a lot of ultimate players have really tight calves, some pretty restricted ankle joints, and that's a good way to kind of open things up and really loosen them up, especially if they've had cleats on for a couple hours and are really feeling some stiffness at the foot and ankle, or even in the calf.
I was literally doing that one yesterday in the garage, so I know it definitely works. It definitely feels pretty good.
Real quick, going to interrupt this episode with the sponsor. It is BreakMark Ultimates. It's an apparel company. You've probably heard of them before. They helped our team, San Antonio Alamo, out with some pretty sick jerseys, the one Shelly's got on here. And then they've also hooked me up with some Tobu Fitness merch. Link in my bio, down in the show notes as well, if you're interested in merch. But I've got the Tobu Fitness hoodies here. So if you're a college team, high school team, club team, whatever it is, looking for jerseys, I think BreakMark Ultimate is a great option. Let's get back to the show.
Want to shift gears a little bit more here. I feel like we're gonna go back to the preparedness part, but a good question I get a lot of times too is just like how can we prevent injuries, right? I know when we talk about injury prevention, I've talked about this in the past, and it's like injury prevention, we can't really necessarily prevent injuries, like, right? There's a lot of things that we can do, and being preparedness is one of those. But to be able to 100% accurately and reliably like prevent injuries, I think pretty much everybody in the field knows is almost near impossible, right? So for the average kind of player out there that's maybe kind of in fear of injuries or just dealing with a lot of injuries, like what advice would you give to them?
Yeah, I mean, first thing I'll say is like I understand those players, because I am that player. I think it's part of why I am a PT now. Is I had gotten injured a bunch as an amateur ultimate player in college, and really didn't find good resources until I actually went to a PT. And one of the biggest things that they stressed to me, and what I stress to a lot of my athletes, is understanding the context in which you're about to operate. And I know that kind of sounds like a non-specific answer, but I think it really holds true. When you can truly understand, hey, this is, the load that I'm about to endure, whether it's, hey, I'm going to play one game today and maybe I'm going to run 3 or 4 miles over the course of that game. Whereas, hey, I have 4 games today. Maybe I'll have a 5th if we make it, to a quarterfinal or something like that, or a pre-quarter. Understanding what your body has to endure allows you to better understand how you need to prepare. And I think that's probably the best injury prevention on a grand scheme that I can provide to people. And then from there, understanding, the stressors of your sport, specifically for myself as a kind of handler defender, and as an offensive handler, I know that I'm going to be doing a lot of small box space movements, and really want to make sure that I'm able to, warm up my foot and ankle really effectively, working on a lot of, single leg balance and some hopping drills, either on 2 legs or 1 leg, working in those small space kind of movements with like cutting drills, is really what I center my training around specifically. And then again, kind of like we had talked about, addressing any mobility concerns or any kind of lingering injuries prior to even really getting on the field and strapping the cleats on, I think is super important. But if I had to drive one point home on like preparedness and injury prevention, it's understand the context in which you're about to play or operate, and understand where you're at physically, and try to, essentially bring those two thought processes, or those two data points into one kind of training program. And I don't think it's always perfect. I think you have to be willing to accept that, hey, I maybe need to tweak this. It's sometimes a little bit humbling, especially for me as a rehab professional, where I'm like, hey, I maybe have a team's win riding on whether I can prepare somebody effectively or not. And it's kind of humbling, honestly, when it doesn't really go your way and a player is maybe not able to be at their maximum capacity. And I think that's where kind of tweaking with things and, finding things sometimes on social media that you think are kind of interesting, or following somebody who's a really highly trained professional and understands, the stressors and the context in which you're about to operate, is really one of the best things that I can advise for players. And Justin, I think you do a great job of it. I think that's kind of how we had initially connected, where I was just watching your videos and watching how you break down movements and provide context for a lot of these players. I'm like, hey, what do I need to do beforehand to actually go out and be able to do this? And I think if you're able to dissect through a lot of the stuff that's on social media and find people who are really specific to what you're trying to do, that's a great way to go as well. But overall point of just understand the context and understand how you need to prepare your body and stress your body beforehand to not get overstressed during competition.
Yeah, absolutely. And thank you very much for that. I want people to know that I'm not paying you. So appreciate the compliment. But no, like I totally relate with that. Like, as somebody that's actively out there talking about how to prepare for Ultimate, how to train for Ultimate, like even this past weekend, I was at a UFA tryout and felt my hip bother me a bit, felt my ankle bother me a bit. And I was like, oh my gosh, like I'm the guy that's supposed to be super fit, and even I'm struggling with stuff. So definitely relate to, like, it's humbling when you got to go back to the drawing board a little bit.
It's especially humbling when it's your own body. You're like, wait, but I thought I had this down. Like, I thought, like I was good. I mean, I went through the same thing in tryouts for club last year, where I kind of just tweaked my hip in such a way that I just like wasn't able to move around effectively. And, even like the trained rehab professionals, where, if I was talking to myself as an athlete, I would say, hey, like, don't keep playing. Like, this is not a good idea. Like, you're increasing your injury risk. And what do I do along the lines of a classic Ultimate player? No, I'm good. Let me put some Tiger Balm on there. Like, let me take an ibuprofen or a Tylenol or two, and like I'm gonna kind of grit my teeth through the rest of this. And that ended up kind of lingering as an injury for me. None of us are perfect. I think some of us have a lot of the information, but it's hard to use it on yourself sometimes too. Have you kind of found as similar things for yourself as a player?
Yeah, absolutely. I feel like I default to do as I say, not as I do, like so often.
Yeah.
Because when you're in it too, like I empathize with clients and people that I talk to, where like sometimes when I'm talking to them, I'm like, oh, it's so simple, it's right there. But then I'm in that situation too, as in, like, when I put myself in that athlete mindset again, I'm like, oh, okay, yeah, I understand. Like, you don't want to stop, you want to go play, right?
100%. And I think the best rehab professionals are the people who understand that, like, hey, as a person on the sideline who is supporting and helping a team, I kind of operate in like my domain and understand where the players are, but also understand like what my role is. And then they can kind of almost turn that off or switch it off to a degree, and then go out and just be a player and like have fun and enjoy themselves, and not really get so caught up on like, hey, I made that cut in a weird way. I know I can do better than that. Or, hey, I made that throw in such a way that like, maybe it's not so great for my shoulder, but it ended up being a good throw. Like, I think when you can kind of separate the two worlds or separate the two minds a little bit, it just allows you to, have a good time as a player and not get so caught up on like injuries and everything. So when these guys are, or guys, girls, whoever are running around and they're kind of trying to fight through injury, I totally empathize with them because I am them. But I think when you have somebody on your sideline or, working with your team that has that higher level of knowledge and can really help you, I implore you to really try to listen to them and at least take their advice and try to run with it a little bit.
For sure. And I think even going a step further, like I definitely understand where a lot of people come from in terms of like fear of injury as well. Like, we're talking about like when you're in the moment, but even I guess like ultimate in itself is so young as a sport and it's kind of like very rapidly progressing. I think where people who like in the nicest way possible, like people who aren't athletes suddenly have to play as if they are professional athletes, right? Like you're saying, the load and the stress on your body, like a UFA game is, one game a week, but like a club tournament that most ultimate players have to go through is like 6 or 7 games over the course of a weekend. And you put like a professional athlete who does professional training and has professional staff supporting them through that, and they will also probably have some nagging stuff, right? So you have somebody who works a desk job that doesn't train like a professional athlete now go out and do all that. Like I definitely see why there's like a little bit of fear behind movement and playing and stuff of that nature.
Oh, definitely. I mean, like even before I was a PT, I think some of the most gruesome injuries that I've seen outside of maybe like 1 or 2 that I've seen as a professional have been as a developmental club player in the Ohio Valley, where it's cold and we have like not great fields, and these players are just out here because they want to have fun, and they do something wrong and it's all hell breaks loose. It's pretty wild. So when you kind of work your way through like each level of the sport, all the way from like youth and development to college, club, pro, I think you kind of understand who the people are in front of you, and maybe what their training level is and their commitment level is, and like how much time they dedicate to the sport. Where you look at these pro guys and they're putting in, it's basically like a second job for them, truly, like taking care of their bodies. But you look at somebody on the developmental side, maybe in either club or in college especially, and these guys, they're out drinking a couple beers the night before and partying until 2 a.m. and they come out for 7:30 a.m. warm up, and they're not really feeling themselves. They're not able to move effectively. So I think when you can really understand that, you can also understand some of the injuries that kind of come out of that.
Yeah, for sure. And how I explain it to a lot of people is like, I think the fear naturally goes to like the event itself or the activity itself, rather than looking at the full picture, kind of like you were saying, right? So let's take like a marathon, for example. Like we all know how marathon training would go, right? And running a marathon isn't inherently dangerous, right? If somebody has been training for a year or 2 years, like they might have some nagging stuff here and there, but they're prepared to run a marathon. Versus my grandma, who has difficulty walking, if she goes and runs a marathon, well, yeah, she'll probably be injured. Like she will not have a good time, right? So it's not that a marathon is inherently dangerous. It's just the level of preparedness. And I think, I think like more ultimate players, if we can look through that scope of like, it's not necessarily that ultimate itself is dangerous. Or I even had a good question recently, like how many years can you play before you're like, it's too much? And it's like, that's arbitrary, right? It's completely different for everybody. It's just about how much you take care of your body, how prepared you are to play ultimate, right?
Yeah, exactly. And like along that same vein, like I think when either trainers or PTs or any other kind of like medical professional starts to demonize like a certain sport or a certain movement or a way that somebody does it, I kind of go back to them and say, okay, like what about this is so bad? Because the human body was meant to move, like evolutionarily, like we were we've been kind of built up to the point where our bodies want to move, they are supposed to move, but moving in a context that you're not prepared for, or moving in a pattern that you haven't practiced or don't have any kind of strength, range of motion to actually do, is that's really where injuries come. Sometimes it's just, a crazy accident where, you just land the wrong way and, tear a ligament or do something like that. Like those are kind of, separate from this, but a lot of those like stress or overuse injuries really come into play when people are just, they haven't done the thing that they're trying to do. And I know that's like such a non-specific answer. Like, yeah, do the thing that you want to do. But like, it really does matter. Like if you've never squatted 400 pounds before and you step on under a bar, like, yeah, it's probably not going to go well because you've just never done it before, never really prepared yourself to do that. And I think that's probably one of the bigger things that I think takes a little bit of time for athletes of all sports to really develop, is understanding like, okay, this is what I'm going to go do for my sport, for my game, whatever it is. Like, what am I doing to simulate that? And I think coaches do a really good job of it. And, any and all of your medical and rehab professionals do a good job of it too. But again, like it's so context dependent that I think you really have to work with somebody specific who understands your sport and like how you move to really get the best benefit out of it. Going on your point about like players, like longevity of careers, I think we're starting to see like this new wave of ultimate players that are playing a little bit deeper into their 30s and into their 40s. I mean, you look at a guy like Bo Kittredge that I think played until he was like, 38 or 39. And he was crushing it. I mean, he was such a workhorse, and he just really, I think he loved the grind. And I don't know Bo personally, by the way. But I think seeing how he operates and talking with some guys who do know him, I think he just loved the grind of just training and like being prepared. And then you got to see that on the field, and he was, pretty healthy, I think, for a good chunk of his career. And, I think that comes down to just like what he did to work and prepare for it. When you look at dudes like, and again, a little bit biased here, like Mike and Ryan Drost, who are, 1 and 2 all time in the UFA blocks category. And, they're in their mid 30s right now, and looks like they haven't lost a step. I know I definitely wouldn't want to match up with both of them because they would crush me. So I think we're going to start seeing longevity of careers probably going even into the 40s in the next couple of years, just with all of the new advancements and the new people that are coming into the ultimate scene and have this level of expertise to really help people take care of their own bodies.
Yeah, for sure. I'm excited to see it. Like when all the info and the technology from every other professional sport just makes its way into ultimate, it's going to be exciting to see. And yeah, shout out Cam Brock too, who was he was on my last episode. But yeah, 35 UFA, all-time leading goal scorer. And he talks about how like he doesn't take breaks. Like he's just constantly training. And I mean, I train him, and I know that. So yeah, a game or a hard practice is just like any other day for him, because he's constantly putting himself through that grind.
Yeah. And he's, I believe, doing it with 2 kids, right? Or at least 1 kid.
2 kids,
right? 2 kids. I mean, like to be at that point in his career and still be at such a high level and be a really key contributor for the Alley Cats and do all of that with a full-time job and 2 kids. I mean, this guy, like it's so cool to see. And see him really succeed and continue to not only be a really great advocate for the sport, but also be a really high level player. Like, again, that's not a dude that I want to match up with ever because I think it would be quite embarrassing for me.
Yeah, I 100% agree. It would be a very, very tough time. Well, cool. So we talked a lot about it from like an individual perspective. But from like a team perspective, if there are coaches out there, or if there are captains of club teams or college teams kind of out there thinking about how they want to structure practice or training in general, would you have any kind of general advice to help avoid, quote unquote, avoid injuries in a sense?
Yeah, I think part of it is knowing the players that, are in front of you. Like that context, like I kind of keep bringing up. I think that's super important. I want to like over stress it, but also understanding what you're going to be preparing for. If this is a practice where you're going to just be scrimmaging a ton, like making sure that you have a adequate warm-up time and maybe actually even extend your warm-up time a little bit, because that, as soon as you get into like the meat of the practice, you're really going to be, working at a pretty high level, especially with those scrimmages. And like on a UFA field, you have so much length and width that you have to deal with. It's a lot of running. So you got to make sure your engine is plenty warmed up before you actually do that. So I think context of the individuals that are in front of you and of the practice is super important. And then, finding something that not only like works for you and is sustainable, but something that the players also like. I think one of the things that I get caught in the weeds on so often is like trying to design something that all the players on the Empire, all the players on whatever team I'm working for, really not only feel prepared doing, but also like doing. Like, if we spend 20 minutes stretching, I think I'm going to lose probably half of the guys on the team because, they just kind of, get bored of it or whatever. But kind of, mixing in new and fun things to keep it interesting for players, I think is something that's extremely undervalued. And, from there, it's just like a general structure. I like to kind of start with like a little bit of a shakeout jog just to kind of get the heart pumping a little bit and, do a little bit of disc skills with that. So just kind of, doing some little dishy passes. And then from there, starting to use your offhand and kind of train that neuromuscular system or really activate it. Either throwing with your offhand on throws that you don't normally do, like a lefty flick. I can't tell you how many people are able to throw both righty and lefty flicks. It's kind of funny to watch, honestly. But preparing your neuromuscular system and with that also can be throwing and catching with one eye closed or turning around and catching a disc that's like coming right at you. I think a lot of that goes kind of unnoticed, and it's extremely undervalued from my opinion. And then from there, like your normal mobility work, maybe a little bit of like dynamic stretching, just because probably don't want to do a lot of static stretching before like some kind of performance oriented task. And then from there, working through a little bit more dynamic, more of a dynamic warm up, preparing some of those motor patterns that you're actually going to go through, or like essentially the movements that you're going to go through. So a lot of what I like to structure is kind of cutting patterns, whether it's some kind of cutting tree or working on the individual specific movements of like, a lateral cut, a crossover cut, some kind of drop step, some kind of like jab step, I think is really important. And then from there, really just trying to get the heart rate up a little bit, warm the muscles up and make sure everybody's prepared. I have a warm up that I kind of follow as like a general guideline, but I think every week I kind of tweak one or two things about it, just depending on, what I'm seeing with the players, what the temperature is outside, what the general, vibe and thought of the team is based on the last warm up or kind of where we're at or what we're going to do for a practice. I know I keep saying context, but I think that is really like at the center of everything that I do with any given team that I'm working with.
I heard a good quote recently, and it was like a lot of people on social media trying to make black and white out of our fields when everything is gray. So I definitely empathize where it's like context. The reason is because of context, right? So I feel you. Like when I do the Q&As on my story, I feel like a broken record sometimes because I always say it depends.
Yeah, and it's such a hard answer to give because you're like, I could write a book about this. I could tell you so much information about this specific thing that you're asking, but is that even going to be helpful if I don't understand the context that you're operating in? But I think you do a really good job of answering questions both like, articulately and efficiently and kind of catering to the masses while also catering to the individual that's asking that question. And I think a lot of the video demonstrations really, come along with that. And I think they're really well done.
Thank you again. Yeah, again, not paying you for the listeners, but yeah, really, I appreciate that. One of the big things that stood out to me too, of what you said is like, that you have to plan according to the interest level of the guys, right? Like, I think that's something that's often undervalued, or I guess just not really looked at in our field. Is a lot of times there's not things that are like objectively better than the other because you have to look at the actual application in practice. Like, sure, there could be a warm-up routine that is objectively better than another one, But if guys aren't going to do it, or they're not going to have focus through it, well, then it's obviously not objectively the best. And I think even at the highest level, like with the team that's won the championship multiple times, if guys are losing focus, then I think club captains and college captains can probably have a little grace with their guys and know that they don't have to stay super focused and treat it like a little drill sergeant session if there's Empire guys that are also kind of losing focus.
Oh yeah, absolutely. I remember one moment from last year. I think we were playing Philly at home. And Philly's athletic trainer, this guy, Josh McCune, is awesome. He's the coolest guy ever. And I look over as I'm kind of like leading through warmups, and they're just like, I think they were like playing like European handball, but in this like small space, like 2v2 or 3v3, just like running around and like laughing and having a great time, just like really messing around, like getting warmed up. And all of our guys are kind of like looking over there like, wait, like, why can't we do that? And it totally like distracted everybody. I like completely lost everybody for a second because they were just watching the Philly guys running around and like having a great time. I was like, man, I got to do something like that. Like that's going to get everybody's attention. They're going to want to do that. So and those guys are super prepared for every game they go into, and they play really hard. And they have, pretty low injury rates too. So if you can find something that the players like to do and they have a good time doing, and it happens to warm their body up, and then you can kind of get into more of the specific ultimate type stuff after that, I think that's a great way to go. And it really just, again, depends like what your guys like, exactly like you said.
That's super interesting. That's super funny. Again, it's interesting to hear that at the highest level, like that's kind of what's going on. Well, cool. I want to shift gears. I got kind of two more questions I want to end it with. Very generally speaking, I know, again, context is going to be the big thing here, but if you had to maybe boil it down to like 3 exercises or 3 maybe points of focus for ultimate players, like just based off of the most common injuries you see?
Oh yeah, that's a fun one. I'd have to say, first off, some kind of neuromuscular training for the foot and ankle. The one that I always like to go to is just throwing a disc back and forth, standing on one leg, and having your partner throwing back and forth and kind of expanding how far you can actually go in your range. So like trying to have you reach all the way out to the side or overhead or all the way down low. I think that's a really fun one for both people involved or the couple of people involved, but also provides a really good training tool for working on one leg, not only, stabilizing and balancing on one leg, but also reacting to what's happening with the disc, the thing that we're going to be using in competition. So I think some kind of proprioceptive or, balance oriented foot and ankle exercise, I think is a great place to start. And then from there, any one of your lunge variations, I think is also great. Again, kind of working on that like semi single leg, but really like dynamic stability in any one of those lunge positions. That's what we're doing all the time. Especially, marking end as a thrower, like you're in that like, split lunge position or in this like end range lunge. And it's really important to make sure that you're strong enough to hold that position, but also strong enough to get out of it. And I think the last thing that maybe goes a little bit underutilized is some kind of relationship between the scapula and the thoracic spine. Ultimate is such a rotation dominant sport. And a lot of players don't effectively rotate through their thoracic spine, which is like going to be more your mid back and kind of like your rib cage, and also don't really have good scapula mechanics or shoulder blade mechanics. I think that's where I see a lot of the shoulder injuries in ultimate, especially in people who are, your more conventional, like big throwers, either your pullers or somebody who throws a lot of hucks. I think those players kind of get caught up. And really any player gets caught up in just trying to like put as much force and as much spin behind the disc as possible and focus a lot on like the forearm, the wrist and the hand, and, sometimes the shoulder, but almost neglect the scapula and the thoracic spine, the two things that are going to be really the biggest power generators for those big throwers. So if I had to boil it down, I would say some kind of controlled, scapula and thoracic spine movement. And I could kind of go through like a huge list of ones that I do in my own practice. But I think the best one is some kind of PNF pattern, like a D2 flexion or something like that. I know a lot of listeners are probably not going to understand exactly what I'm saying there, but some kind of coordination of how your thoracic spine and your shoulder blade work together, I think is something that goes very underaddressed.
Yeah, that's super interesting. And I think what we can do is for the listeners, we'll put it down in the show notes or the description, maybe some demo videos. And we'll also just kind of list that stuff out, because I'm sure, if you search up D2 pattern, I think there will be plenty of videos out there. And then last question I have, this is the one I like to end all podcasts with. It's my favorite question now, but I'd like to know kind of what the greatest minds in the sport are pondering, right? Like, I want to know what keeps LeBron up at night thinking about basketball. So for you, like, what are some of the big questions that are kind of going through your mind as far as ultimate or injuries?
I would say as a chronic overthinker, there's a lot of things that keep you up at night, from like work to ultimate to, just like general life stuff. I think the thing that has been keeping me up at night most frequently is it's trying to understand what makes a great player great. And I know that's like so non-specific, but being surrounded by so many high-level players in the New York scene, and specifically with the Empire, trying to understand what makes somebody tick and what makes somebody so good at what they do really does keep me up at night. So like running around, with Jack Williams during the spring and the summer and into the fall, and just watching him move. And he's like a very athletic guy, but he has like fairly similar build to me, probably a little bit taller. But just understanding like, okay, how does he do what he does on the field and just like succeed all the time? Like, how does this happen? Because it's not like he's this big imposing figure like Yacht and like Jeff are. I kind of at least have an inkling of how they are so successful at what they do. But looking at a guy like Jack, he like, how does he get to where he is? I think is one of the things that really keeps me up at night, and trying to maybe model that in some kind of programming, honestly, a little bit selfishly, but also for, all of the athletes that I work with, like how do I as an individual get myself and others to that level, or some semblance of that level? The initial thought that's been kind of running around my mind is like hard work. And that's definitely part of it. And I think some of it is, talent and genetics. But I think maybe what it boils down to is just like love of the game. And I think I found the love of the game, both on the field and on the sideline. And I think Jack has found the love of the game in pretty much everything he does surrounding Ultimate. So that's probably the thing that's kept me up at night most frequently, especially as we're getting close to tryout season and getting close to the regular season.
Yeah, I'm sure there's a long list of former or current defenders of Jack Williams that are also thinking the same thing, probably losing some sleep at night over that.
Man, I think back to, I don't know if you'd watch this game. We were playing Philly at home, playing Philly in Philly. And Oscar wasn't playing that game. And we were like, pretty like neck and neck with Philly going towards I think it was in the fourth quarter this happened. But Jack's, I believe, getting double teamed with the disc. And he kind of makes this like weird, almost like backhand pivot, and quickly turns around and like almost over his shoulder throws a flick huck. And it just happens to land like right in somebody's lap. And it was like exactly like he drew it up. And he kind of just comes off the field and he's like, I don't know. I guess that happened. Like, that was pretty cool. And I think about that play constantly. It's just like, how do you even like prepare for that? Like, how does that happen? Sometimes some of it's probably a little bit of luck, but some of it's just like, okay, he knows where everybody is on the field and he can just put it out there, even if he's not looking at it. Like, how do I train that into somebody? It's such a cool play. I watch it like an embarrassing amount, honestly, because I just try to break down every aspect of it, and it's almost impossible to do.
I'm gonna have to look. You're gonna have to send me that afterwards. I want to take a look for sure. But yeah, that sounds insane.
Yeah, it's one of the wildest things, and just getting to like hang out with these guys, on every Wednesday and either Friday or Saturday is such a cool thing. Just trying to like, understand how they tick and hang out with them and just have a good time and like do the thing that we all love doing. It's truly a blessing.
Yeah, absolutely. Well, yeah, this has been a great show. Ryan, if people are interested in learning more, if they want to work with you, where can they find you?
Yeah, I mean, I think the easiest way to probably work with me is just shoot me a DM on Instagram. It's Ryan Andersen 52. The DMs are open. I'm happy to talk with anybody and just kind of chop it up a little bit, just because I love talking Ultimate and love talking PT. And then my company, Spirit Physical Therapy, we do both like in-person consultations and treatment, but we also do telehealth, and myself and my colleague Alexis Sarabia, along with a bunch of others who work in the sports world, are available through all of that, and we're more than happy to help you guys out.
That's awesome. Well, yeah, once again, I think this was a great episode. Really good to do this. Ryan, thank you for being on the show.
Justin, thank you so much for having me. This is really cool. It's been really fun.
You've been listening to the Tobu Fitness Podcast. Our passion is to be your guide in elevating your game and mastering the art of ultimate frisbee through the lens of strength and conditioning. No hype, just substance. We hope you've enjoyed the show. If you did, make sure to like, rate, and review. We'll be back soon, but in the meantime, hit us up on Instagram and YouTube at Tobu Fitness. And to get info on one-on-one coaching and training programs, hit the website at tobufitness.com. Thanks so much for listening, and see you next time on the Tobu Fitness Podcast.